Hello everyone, this is Synthia de Jesus, and this is my fall prevention teaching project. So the content will be fall prevention. This information will be perfect in a unit-based orientation. It's beneficial for those actually caring for the dementia patient. Why? Because a lot of issues, there's several risk factors associated with these patients' age, gait, vision, and certain comorbidities, and it makes them prone to head injuries, causing them to be hospitalized. So the intended audience would be CNAs, LPNs, and RNs, because they work directly with the dementia patient and are the ones responsible in providing the patient care. So the objectives would be, following the 30-minute learning session, the staff will be able to explain what are the consequences of falls, risk factors, and interventions for the high-risk dementia patient. During a group session, unit staff will express the concerns about a patient fall incident. Then after the learning session, the staff will respond to a scenario that will demonstrate their skills in addressing a patient at risk for falls. So for preparation, there'll be posters posted at the nurse's station. There'll be emails sent so that staff can sign up. And this will be before shift report. Prior to the course, there'll be a syllabus sent. And we'll let them know that there'll be a welcome quiz prior to the first activity and to assess the staff knowledge on fall prevention. And according to Billy and Halstead, time spent should be relative to the concepts and content and students' ability to learn the material. So certain obstacles. Well, staff can become bored, so that's why there'll be group discussions and scenarios for the staff to interact. Some staff are shy, so that's why there's an interactive whiteboard that can help with the learning for students that are less verbal. And then they can represent themselves with writings or images rather than verbal. Then there could be lack of time, too much hustle and bustle. So this will be 30 minutes in length before shift report and in the break room where there's less quiet, where there is quiet. So the content. There'll be a welcome quiz in the beginning. Then the definition of falls, which will have lecture and visual aids with the risk factors. Then the management of the dementia patient with discussion and the interactive whiteboard, which will be explaining the role of each staff member, the RN, the LPN, and the CNA. And then there'll be the interventions that will be used in fall prevention. We'll be talking about tab alarms, the hip protectors, floor mats, and then the hourly rounding. Then the simulation, a fall scenario with observation and return demonstration. And then the students' experiences with falls, which will be reflection and group discussion. And then at the end, there'll be a post-test, so we're gonna see what they know, and then questions and answers. Teaching strategies will be demonstration. This helps enhance cognitive and affective learning and interactive skills. There'll be lecture. It's a great way of reviewing information, highlighting main ideas, and a better understanding of a subject. This will promote student questioning and enhances further knowledge of a particular subject. Then there'll be discussion. It'd be a great way to, recognize different issues, get better communication skills, and increase ability to work in groups. The simulation is a great way to enhance psychomotor skill development, problem solve, and provides active learning involvement in real life situations. And also, the staff will be in a safe environment so they can learn new techniques from each other and from the educator. So, critical thinking approach. The instructor will be providing visual aids and handouts that enhance learning so staff can follow the lecture. When they use different teaching methods, it helps promote and nurture critical thinking processes and understands the various answers to a problem. Questioning also enhances what people have learned and helps promote evaluation and synthesis of facts and concepts. During simulation, the learners observe what is being done, promotes and invokes new sites and sharing and fostering critical analysis of their actions, and challenges them to explore other solutions that could have been implemented in the activity. And also, this is a great way for teamwork and learning from each other. So linking it all to a good evaluation. The welcome pre-test addresses staff knowledge. So there'll be some questions provided to see what they already know. Definition of a fall and risk factors brings a new meaning to falls and consequences. The educator will write what is a fall and then provide the videos and lectures on fall prevention. Then learning about the role of each staff member. Staff will learn what each member is responsible for. What is the RN, the LPN, the CNA responsible for? Interventions increases staff knowledge of what interventions benefits their patient. They will learn about the tab alarm, the hip protectors, the floor mats, and the frequent rounding by checking for pain, potty, possessions, and position. The fall scenario. The staff will learn to work together and understand each other's roles. The patient will be on the floor. Staff has to identify what could have been prevented, and then they have to work according to their scope of practice. At the end, there'll be a debriefing, and there'll be a question on what was misplaced, what interventions should be done, and what was their particular role. So they have to identify and answer those questions. Experiences with falls. The staff will reflect on past falls and get to learn. They still get to learn from each other. And there will be a question on what happened to one of your patients that you thought could have been prevented prior to falling. So there will be a group discussion on the topic. Then the post-test, testing on the new knowledge. What are some fall prevention interventions? What is your role when a patient falls? What are some risk factors? What can you do to prevent a fall next time? So what is the outcome? Well, of course, completion of the training. Participation is very important in all the activities and discussion, which helps promote communication and teamwork and beneficial for the care of the patient. The simulation also incorporates teamwork and teaches the staff on role responsibility and any questions they can have. And we're hoping after the completion of this course, there will be a 90%, at least a 90% pass rate. So the teaching effectiveness assessment plan. I'd be watching how the staff are attentive and interactive. Question them during lecture and simulation. At the end of the course, there'll be an evaluation, which will assess what may need improvement and what went well. Have a pass rate of 100%, and most importantly, hope that the staff understands the importance of patient safety and fall prevention. Now, if this was a longer course, I would be using gaming and case studies to have it more interactive for the staff. And then these are my references that I used. And I hope that you guys can great feedback, and I really thank you for listening to me and wish you all the best. Thank you. Have a nice day.